when I decided that I was not going to take insurance, a part of me was worried that I was kind of only going to take care of wealthy patients who had the money to be able to pay. But it turns out that there's a lot of people who have jobs and make money, but don't have insurance. And because of that, they are a lot smarter with their health spending.
Welcome to another episode of the Physician Growth Accelerator Podcast, a show where we break down your private medical practice systems into vitals, give you the tools to diagnose root cause of what may be restricting your growth, and prescribe what to do about it. I'm your host, Zed Williamson, and I believe that everything we experience is the perfect outcome of our current system. And the power in that statement is it gives you the chance to take responsibility. And if you're not really excited about the current outcome of whatever system you're thinking about, we just have to take a step back and tweak the system. And something that comes up a lot in private practice is patient experience. And I'm really excited because we have a special guest to discuss this topic specifically. And I'd like to introduce her, Dr. Ashley Agan, board-certified otolaryngologist, founder of Scotty, a boutique ENT practice, and co-host of the Backtable ENT Podcast. Ashley, thank you so much for joining us today.
Thank you so much for having me. I'm excited to chat with you today.
Absolutely. This topic is interesting, the idea of patient experience. It gets defined many different ways. You sometimes run into barriers from a mindset of too busy to worry about that. There's so many things. But what I would love to start, because you have created something really interesting with Scotty. I'd love for you to start with the origin story of where did this practice idea come from? Why does Scotty exist?
Sure. So let me think of how far we want to go back. When I decided to go to medical school, there was the vision was always to kind of have my own practice. That's just what I always thought that I would do, is have my own private practice, and it would be my little thing. And then, med school, residency, the years go by. And my first job out of residency, I was hired in academic practice. And I did a lot of different, in academics, there's lots of different positions within the university. I was medical director for a couple of our satellite clinics. And so there was some of that kind of practice building, starting something new within that. And then, last year, I got promoted to associate professor, kind of looking at mid-career and kind of thinking, okay, what's next for me? And that kind of itch, that feeling of like, are you ever gonna have your own practice? Like, are you gonna do this? Are you gonna look back and think, oh, what could have been? And so it was kind of like, okay, maybe it's now. Maybe I need to do this now while I have the energy and the the drive to do something kind of scary. And so in the middle of all this, kind of going back to the story of Scotty. So Scotty is was my grandmother's nickname. Her name was Shirley Ann Scott. And I guess it would have been in 2022, my mom called me and said, Granny has like a really swollen abdomen. Like we don't know what's going on. Her doctor ordered CT, da, da, da. Long story short, she was diagnosed with ovarian cancer, and it was, widely metastatic, and just was a really grave diagnosis. And so I'm the only doctor in the family, and I'm an ENT doctor, right? So I don't know anything about ovarian cancer, but it fell on me to really help navigate the system when this, kind of came up for her. Even from the very beginning, she had been referred, after her CT scan, she had been referred to a GI doctor. And I was like, no, that's not the right, that's not the right doctor. Let me help. And so I kind of, called around and tried to help facilitate appointments. And even with me kind of knowing who to call and what back phone numbers to get a hold of,
Mhm.
it still was just really challenging. And there was long wait times. And if I didn't get to go to the appointments, like, so even with my mom and my aunt both there trying to like write everything down, like sometimes they were like, I don't know, and then I would have questions, of course, and they were like, I'm not sure. And so it was just really hard, and I just, you know it was so frustrating for everyone. And I think having gone through that, I thought, man, it made me kind of hold a mirror up to medicine. Cause I felt like a lot of the time when my mom and my aunt would complain about healthcare, I would be defending. I was like, well, you
Yeah.
don't understand, like he's got a lot of other patients today. And they're trying, I was kind of always trying to defend the why it was so horrible. And then, and so that kind of brings me to deciding to start my own practice. Um, that was really at the front of my brain of like, how can I create something that is a better patient experience, and that, is really patient-centric and focused, and, down to like, how can I have the least amount of paperwork possible? And, how can I like not ask people to complete the same paperwork over and over again? All the things that we've all done, because if you've ever seen, a physician or been in healthcare, you kind of do this and you kind of tolerate it because you're like, this is the system. But I think that's really my singular focus in this practice, is to have something that's really special, that is an enjoyable experience as much as, going to the doctor can be enjoyed.
Yeah, it's a powerful story, and it's fascinating. I'll probably get the quote not exact, but if we go back to Shakespeare, nothing is good or bad, only thinking makes it so. And you witnessed the same system, but you just witnessed it from a different perspective, which changes our thinking. And it's crazy how powerful that is, and how often our mind or brain wants to keep us in a comfortable spot and keep the perspective that allows us to ignore those things. And it's so powerful to understand the impact on the human who is the patient, so that you can really do something about it. It's not just, um, you know, surface talk of, we want a nice, experience. No, you really care about how they feel. And that's different.
Yeah. Yeah, absolutely. It's and even, being a patient, being on the other side of it changes the way you show up as a doctor. Every time you're reminded of how much it sucks to be a patient, like it helps, I think it makes you a better doctor.
Yeah. So is there anything specific that was really important to you that I know you mentioned kind of reducing paperwork, but what have you witnessed in the practice, interacting with patients, feedback from patients? What has either surprised you or things that you expected and you're hitting the mark? What kind of things are you experiencing?
Yeah. So the biggest feedback that I get from patients is that it's not rushed. And so, and I guess I should have said this at the beginning. So the way my practice is set up is, I'm out of network with insurance. And so patients just pay for their visit. If they have out of network benefits, then I can give them a super bill, they can file it, and, maybe get reimbursed. Most of the time, most patients have really high out of network deductibles. So I
Yeah.
don't, I always warn that I don't have any control over whether or not they can get reimbursed, but some do. But because of that, so my new patient appointments are scheduled for an hour. And so it's a very different pace. And, um, I have a lot of patients who are seeing me as like a, you know, a third or fourth opinion. So sometimes there is a lot to go through, and it's just, you know, a lot of the times when we're done, you know, patients will just kind of remark that, oh, wow, like that was so nice. Like you didn't, you know, you one guy, I remember he kind of was chuckling at the end of the appointment. He's like, I'm sorry, this is just so different that, you know, we've been sitting here talk, because sometimes we also talk about, you know, the weather or
Sure.
the vacation that's coming up, or, you know, sometimes it's not even relevant to whatever they're there to see me for. I actually get to spend a lot of time getting to know my patients. Um, and so it's just a very, very different experience than what most people are used to when they go to the doctor. And it's, to be honest, like, I think that one thing that has surprised me a lot is that it's a better experience on my side too. like I mean, nobody really enjoys being rushed. Um, and so it's just, I love the pace of it. I love being able to take my time and talk to people and get to know them, in addition to kind of taking care of whatever they're here to see me for.
Yeah, when you hear statements like that from the gentleman you mentioned, that has to hit you pretty deep, right? That's
Yeah, it's so cool. And the other thing that patients like is that a lot of times when they're messaging, they are messaging with me, because it's just, it's a,
you have
you
the
know,
bandwidth.
I'm not, yeah, because of the different pace. Like if a patient sends a text, a lot of times it's me texting them back. And like I had a patient last week that was asking me, she's like, okay, you know, I'm going to follow up and I'll let you know, like, how should I do that? And I was like, oh, you can just, you know, send me an email or call me. And she's like, call you? Like, I'm going to talk to you. Like, I don't want to bother you. I was like, no, it's fine. Like, you know, and they're just like, oh my gosh, that's, you know, it's just a much, much more personal connection.
Yeah, that's powerful. Um, we get so busy that sometimes we forget the importance of that community, the connection, the human connection. And I don't know if there's any exhaustive studies about this. And this is kind of a weird statement that many of my listeners may not appreciate me saying because of that. But I would probably bet money on the fact that if we could remove all other variables and just have that experience be the only difference, and you see patients and perform the exact same procedures on them as someone else who put them through a different existence, that your patients would have better outcomes. And it's the power of that connection that, you know, there are interesting studies around what influences
Mhm.
surgical outcomes, you know, beyond the actual surgery itself. But it's I don't know if you feel I'm way off base with that
No,
thought
it's
or.
true. No, I totally agree. I think, you know, that our mind is powerful and works in ways that we don't understand. And it's just like, even when you think about the placebo effect itself and why we have to control for that, because
Yep.
if your brain thinks that something's going to work, it's going to work. And so I think if you do have, I think having a positive relationship with your doctor, your surgeon, I would bet that I'm in the same boat as you. I would bet that if we studied that, that patients would have better outcomes just by believing that they're going to, because they believe in their doctor.
Yeah. When you get feedback from patients, what else is anything else surprising you from the standpoint of do like from as a physician, are you learning more? Are you able to diagnose differently? Like what else are you experiencing within this system that you've created that is different than what you experienced before?
Yeah. So some surprises. One big one in the beginning, I think when I decided that I was not going to take insurance, a part of me was worried that I was kind of only going to take care of wealthy patients who had the money to be able to pay. But it turns out that there's a lot of people who have jobs and make money, but don't have insurance. And because of that, they are a lot smarter with their health spending, and they look for, you know, like direct care practices like mine, because, you know, my price, you know, my office visit pricing is on my website, and there's not going to be a surprise bill coming in afterwards. And so that's been really surprising and nice to be able to offer something to that group of people that I wasn't really aware of. Like in academic medicine, we're just kind of seeing who comes through, and I didn't quite appreciate that piece of it. And also the patients who have insurance, but they have a very high deductible, and so they're spending a lot anyway. So that's been really surprising and cool. And the other thing is being able to offer treatments that are not being covered by insurance anyway. You know, examples would be like there are devices to place office tube ear tubes for kids. And I think some insurances might be covering them, but some not. There haven't been a lot of ENTs that have started doing it yet. And so I, you know, learned how to do that and started doing it. And suddenly there were lots of, you know, people looking for it, which was interesting, because again, I had no idea there would be a demand for something like that. And so, but the families are so appreciative to be able to have that done. Things like posterior nasal nerve ablation with Rynair, like as far as patients looking for a cash price, I'm able to offer a very reasonable cash price. So I've had patients who come specifically for that, because it's, you know, affordable and worth it to them. So things that I'm learning along the way.
Yeah, it's great, because I'm curious, with the children, is it a device that allows you to avoid anesthesia?
Yeah. So there's no general anesthesia. For the small kids, we just swaddle, you know, like use a
Yep.
papoose, just like you would if you were trying to get a rock out of the ear or something.
Yep.
And the device, there's two on the market. One is called Hummingbird, one is called Tula. And then Storz has got one coming out too, but essentially it's like an ear piercing gun, where you're taking the act of making the laryngotomy and placing the ear tube and putting that in one move. And so if you can have, you know, seconds of keeping the patient still, then you can put in an ear tube in the office and avoid general anesthesia and fasting. And like, I think about half of my patients have sought it out because of expense, because, you know, the facility fee where they
Right.
were going to go was going to be really high, and they were just, it was cost prohibitive. Because this is done in the office, you know, it's significantly less. And then the other half of patients are because of just wanting to avoid general anesthesia.
Sure. What you're experiencing, this is where, you know, healthcare, with kind of air quotes around it, is weird, because it's trying to become a consumer business, and consumers are trying to make it consumer-y, if that's a word.
Mhm.
But the challenge is the way reimbursements exist, what people believe about insurance, and what you're witnessing is true decision based on value. You know, there are patients out there who insurance would cover their ear tubes. They choose to pay to not have their kid have anesthesia. That
Yeah.
makes complete sense. Rynair, those people that are dealing with you know, constant dripping nose, I think that's what that works for, right?
Mhm.
Super frustrated, and if insurance isn't going to help them out, what they're doing is they're finding the solution. So it's cool, because there are people in the world that would hear about a practice like yours and go, that can't be just because it can't be. As opposed to, when you strip it down, healthcare has gotten weird, and it's removed the value from what the patients are getting, where they just go, oh, well, insurance will take care of it. And they're not actually viewing it as a true consumer. And you're seeing what happens. Hey, I don't want my kid to have anesthesia. They'd probably pay a lot to do
Mm-hmm.
that.
Yeah. Yeah. And they will travel. I've had patients who've traveled because they don't have anybody close to them doing it. It is amazing. And I think in today's world too, there's so much information available to patients. Patients are definitely taking a lot of that. I guess not all patients, but a lot of patients want to be more informed. And so they're looking online and they're looking for resources, and they're just a much more they're playing a much more active role in their own healthcare than maybe maybe 20 or 30 years ago.
Yep. Agreed. Now, I think I really appreciate what you're doing, the perspective of patients. There's so many things built into our brain that kind of creates bad patient experience. There's practices today, I guarantee you, that are exhausted seeing patients, and the patient towards the end of the day is getting the procedure explained to them by someone who's explained it 97 times in the last week. It doesn't really mean much to the person explaining it, and the patient is hearing maybe 1 out of 10 words, is freaking out about the one that they're hearing, and you're removing all of that. It's so many of the issues that we uncover when working with practices. It's not this one little fix. It's you're basically stacking problems by not taking care of that communication, which you're handling through human connection and community, which is known to be really important to us human folk. So I think that's really good. And tell me about the Backtable ENT podcast.
Yeah. So Gopi Shah and I we met back in training. She was my fellow, my peds fellow when I was a resident. So we've known each other for a really long time. And her husband started a podcast. And then a couple years later, we said we're going to do that too. And so he's an interventional radiologist. So his podcast was, the original Backtable. And then we were the first kind of next show called Backtable ENT. And it's, doctors talking shop. It's peer-to-peer conversations. A lot of it is clinical. How do you like to take care of the patient with XYZ? We talk about some kind of off non-clinical random things too, but it's been so fun. We've been doing it for 4 years now, and and I'm sure you've probably experienced this with podcasting, you like getting to meet people. And I find that I have this big network of like friends, kind of, because we spent an hour, just kind of like talking shop and learning about each other's practices and how we think about things. And there are people who I have reached out to, a year later, being like, oh, hey, I saw this patient in clinic, and is this like something, when you talked about this, would you do it this way? And it's been really fun. And then it's grown, and like we've gotten great feedback from our peers that they like what we're doing too, and it's helpful for their kind of continuing education. And so yeah, it's good. And then we've got other shows other than ENT now. So we have Backtable Urology, OBGYN, MSK. There's a innovation show. I might be missing one, hopefully not.
Vascular.
Yeah, vascular.
Yeah,
So,
that's great.
yeah, it's good.
It's good. So, listeners, definitely check out Backtable. Like she said, there's more specialties than just ENT. So, but really it's like there's always nuggets, right? I'll listen to episodes. Obviously, I don't operate on anybody or treat anybody, but there's always something to learn that we can take from. And Ashley, I really appreciate you joining us today. I love what you're doing with Scotty. It's awesome. It's important. bucking the system in a way that the system needs to be bucked. And I hope that people learn and kind of follow suit a bit. And I'm really happy for your patients. If someone wants to reach out to you, what's the best way if they want to kind of tug on your ear or learn more?
Yeah, absolutely. I'm happy to chat with anybody. I am on most of the socials, so in Instagram at Ashley Agan MD, Facebook, LinkedIn. I'm I've tried to dabble on TikTok, but I must say it needs a little work. So the former platforms I'm on more frequently. It's
Yeah.
hard to keep up with all of the
Oh my
social
gosh,
media stuff these days, to be honest. But
it is.
they say you got to do it. So here
Yeah.
we are.
Wouldn't mind having a conversation with they, but um, well, Ashley, thank you so much. And also visit physiciangrowthaccelerator.com. You get access to all the episodes leading up till now. And you can take an assessment to kind of see where your practice is. Imagine a symptom score for the health of the business of your practice. And it might help you just identify where you might need to dig in a little bit and address some root cause that may be restricting the growth of your practice. And with that, we'll see you again on the Physician Growth Accelerator.